The REVEL trial compared docetaxel, standard second-line lung cancer therapy, with docetaxel plus ramucirumab, the VEGFR2 antibody, and included both squamous and non-squamous lung cancer. And actually, the toxicity results suggest that one could give the drug in both settings. And there was an improvement in survival across the board in both squamous and non-squamous. Off the top of my head, the hazard ratio was in the mid 0.8 range. Not the highest one has ever seen, but clinically significant and statistically significant, and there is some benefit. This drug was approved almost at the same time as nivolumab, so many people are in the second-line setting use nivolumab, which has relegated this to the third-line setting. But I think that it clearly is better than docetaxel if when we're going to use docetaxel, adding minimal additional side effects. And I also believe that the ramucirumab might have some role with immunotherapy in altering the microenvironment in favor of the immune therapies working better. Toxicities are managed, in the usual ways. When you add ramucirumab to docetaxel, the main toxicities are still going to be neutropenia, probably only slightly exacerbated by the VEGF inhibitor, certainly neuropathy with docetaxel, and you would manage it with supportive care, treatment of febrile neutropenia when that develops, blood product repletion if that's needed. But we've gotten pretty good at giving docetaxel. It's a tough drug, but certainly very manageable. In the second-line setting, these days most people would use immunotherapy unless they really had a reason not to. The reasons not to would be some sort of autoimmune disease or pneumonitis, psoriasis, something that was pre-existing that would make you concerned about using an immune checkpoint inhibitor that would activate the immune system, or someone who was terribly symptomatic to the point where you were worried that the immunotherapy wouldn't have more than 2 or 3 weeks before the patient needed something to be done for their symptoms. And there you'd want the best response you could get, and that would probably be with docetaxel and ramucirumab combination.